gave you cards if you've answered, if you've written questions on them. If you need extra blank ones, we can get you more blank cards. And our next and the last presenter is Marcia Okon, member of the Chamber of Commerce.
Thank you. Well, welcome everyone. I'm Marcia Okon. I'm with the Manhattan Chamber of Commerce. Before I get started, you all have a survey. As Carrie mentioned, we are working under the Small Business Assistance Program umbrella, and the state is looking to gather data. This is an anonymous survey. You're not putting your name on it or anything like that. To help us assess the success of these educational efforts. So I would very much appreciate it if you would take a few minutes to fill this out. It's a front and a back. The single most important field for you to fill out is on line 1, your zip code. So we know the kind of coverage we're getting with these educational opportunities. You can just leave them on the chairs when you're leaving, and I'll pick them up afterwards. So thanks a lot for taking care of that for us. So my portion of the program is going to be to talk about the Affordable Care Act, and in particular, how it affects the small business community that's going to do their shopping in the small business marketplace. You know, Alice talked a little bit before about how every insurance plan in the marketplace is going to have the 10 essential benefits in it. Well, the other thing that every plan is going to be doing in the marketplace, it's going to be organized in what we're calling metal tiers. It's kind of like the Olympics for healthcare. So the bronze tier is what's considered the minimum actuarial level tier. That's a kind of technical term, but what it basically means is that the plan will cover approximately, between your coinsurance and all the pieces of the puzzle financially, 60% of a covered benefit, and the consumer themselves or the employee will be responsible for the remaining 40. The silver plan is a 70-30 split, the gold plan an 80-20 split, and the platinum plan a 90-10 split. So as you think about the insurance plans that you may be currently offering your employees today, you can kind of think about which one of these types of levels you're currently in. And when you think about your employees going into the marketplace to shop for insurance, you can see how the standardization of the plans in metal tiers combined with the 10 essential benefits will make it very easy to compare and contrast Plan A in the silver tier to Plan B in the silver tier, to Plan C in the gold tier, or like that. There will be a special plan called a catastrophic plan for employees who are under the age of 30. Basically, it's a high deductible, very low premium kind of plan to try to entice young people who, as Alice said, tend to think of themselves as extremely healthy and in general are, to purchase coverage just for that moment, that unexpected thing that could happen. Hopefully it never will, but if it does, at least you know you're going to have something to back you up from an insurance perspective. So as we've heard, you know, there are kind of two sides to the marketplace. The side where individuals and sole proprietors are going to be shopping, the individual marketplace, and the side that I'm talking about here, where the employers are going to be shopping, the small business marketplace. In 2014 and 2015, the small business marketplace is open to firms with 2 to 50 employees. Starting in 2016, the small business marketplace is going to open up to employers with 2 to 100 employees. So the first 2 years, 2 to 50, starting in 2016, 2 to 100, and we'll see what happens after that. I just want to let you know where we stand today. There will be, as you heard about, there will be financial incentives for sole proprietors and individuals. There are also financial incentives to entice our small business customers to shop for insurance in the marketplace, and I'm going to be talking about that in the form of tax credits and explaining that in a couple of few minutes. Again, the marketplace is open for business for employers. You can enroll throughout the year based on your policy anniversary date, you can also enroll new hires as they may come on board throughout the year. So you'll be able to deal in the marketplace whenever you need to be there. So this is kind of a representation of how we envision all of this working, where the insurance carriers and the small business community are going to meet within the marketplace to do business. By the same token, if you want to continue to work the way you are today, directly with the carrier, there's no legal prohibition to doing that. But we think that the incentives that are going to be available to you working within the marketplace are just going to make it too tantalizing to not want to do it that way. And those incentives, which Alice had mentioned, and I'll just kind of recover again, are the variety of choices that you're going to be able to offer your employees, the fact that it's going to be a lot easier for them to compare plans when you make the selection in terms of what you're going to make available to them, the fact that you're not going to have to take on a lot of administrivia because you can offer a lot of different plans, but you're only going to have to deal with one invoice on a monthly basis, which is really nice. And of course, the big financial carrot in the form of tax credits. So those are all the reasons why we're thinking that it's going to be a lot better off for our small businesses to come into the marketplace sandbox to work with the carriers. So there are a lot of different options, multiple metal tiers, multiple plans with potentially within the tiers for an employer to choose from. And the marketplace is extremely flexible. So you can choose whatever's going to work best for your employee community, meaning you can choose a series of plans from a single carrier, you can choose a series of plans by metal tier, you can choose a series of plans from multiple carriers, you can offer your employees everything that's in the marketplace and let them go forward and pick what they want. So again, very few limitations on what you can do, but the marketplace recognizes that because you know your employee base best, you may be able to do a little filtering for them to give them fewer choices, but again, that is completely up to you. It's also completely up to you how you want to set your premium contribution when you're setting up your account in the marketplace. Meaning, we know that some employers like to offer their employees what we call an uncapped percentage. I'm going to contribute 50% on a monthly basis to my employees' costs for health care. Now, there are some employers who might say, gee, if I'm offering a menu of different plans to my employees and I don't know which ones they're going to pick, I don't have a good enough fix on what it's going to cost me, and I'm not so happy about that. So in that case, you might want to go to option B. I want to do what we call a capped percentage. I want to contribute 50%, but I want to put a cap on that. No more than $300 a month. So at least I have some idea and some sense of control over exactly how much I might be on the hook for as an employer to have to pay. Lastly, there may be some employers who don't want to go down the percentage path at all. They want to pick a specific fixed dollar amount. I worked for a small business, and that's exactly what they did when we shopped, in a portal. And of course, the only reason I remember this is because it was such a bizarre number. They contributed a flat $242 for me to any plan that I wanted to choose. So if you want to pick a $241 dollar amount or any fixed dollar amount to set as your premium contribution, you can do that as well. So again, these are the kinds of things that you're going to want to be thinking about before you head to enroll, because you're going to be asked these questions as you go through the enrollment process, so that as an employer you can set up the account, and then eventually, once that's all done, your employees will be able to come in and shop within the framework of what you're making available to them. Now here in New York, the marketplace recognized very early on that a lot of small businesses like to work with insurance brokers, and the marketplace has embraced the broker community. So if you like to work with an insurance broker, you are welcome to do that. They are commissioned the exact same way. They make money from the insurance carriers, but they will earn the same commission whether they're selling Plan A inside or outside the marketplace. So there's no jeopardy one way or the other in terms of where they may be offering this product, and no incentive for them to offer it in one place versus the other because they make more money. There's no extra cost to you to work with a broker if that's what you would like to do. However, as Alice said, all brokers must attend certification training, and the insurance industry requires insurance brokers to take continuing education classes throughout the year. So the marketplace certification class delivers 8 CE credits. So if you have any colleagues who may be insurance brokers and they don't realize that they can participate in the marketplace, they can, and there is an incentive. They can get some CE credits, which they're required to accrue throughout the year. I will mention that in order to certify on both sides of the marketplace, meaning the small business side as well as the individual side, you must take the small business certification class first. So you can't just come in and take the individual class. So if you're thinking about certifying on the individual side only, just know time to head into the small business class first, because they won't let you into the individual class without the small business one up front. For consumers, there will be a list of certified brokers available in the marketplace. So if I want to shop and I want to look for a specific broker, or I want to look at the certified brokers for a specific plan because the brokers can set up their plan affiliations, I'm going to be able to do that. You know, the only thing I would suggest to everyone is if you're going to work with a broker, that's great, but just ask them the question, make sure that they have certified so that you have the opportunity to work with them inside of the marketplace as well as outside if you so desire to go that way. While brokers will manage or help employers manage their accounts, again, just want to make clear that all of the financials in terms of invoicing are going through the marketplace, meaning there's no money going back and forth in terms of premium payments with the brokers. That will all be handled by the marketplace. Not to beat a dead horse, because we've heard it from both Alice as well as Carrie, but you don't need to work with a broker if you don't want to, and many employers are going to be able to set up their own accounts all by themselves. However, if you do get into trouble, you hit the wall, you need some assistance, as you've heard before, you can get assistance online via web chat, you can work with a certified navigator, or you can call the call center. So lots of different ways to get help if you get stuck along the way in the process. Now I'm sure, hopefully, everybody's done this already that's running a business, but just in case you're going to start a business in 2014, or you're going to be bringing on employees in 2014, I just wanted to make sure that everybody was aware of the requirement for employers, if you're subject to the Fair Labor and Standards Act, to provide a written notification to all employees about the marketplace. So this has to go to all employees, full-timers, part-timers, any-timers, some-timers. Assuming you've got a business going, this is something that you should have submitted to all current employees already, meaning last week. You should have done it by the 1st of October. I'm not going to cheat and tell if you didn't do that, but want to get moving on that. But I did want to remind everyone that for new hires, this notification has to be delivered within 14 days of their start date. So again, if you're setting up your own business in 2014 and you're going to have employees, you're going to need to put together this notification. If you're subject to the Fair Labor and Standards Act, if you already have employees, new hires have to get this. I just want to make sure everybody has a sense as to the content of this notice, which, oh, by the way, with all due respect to any attorneys that may be in the room, no legalese in these notices. Just follow the KISS principle. Keep it simple, make it easy to understand so that every employee knows what you're telling them. And the core content requirements are, you've got to let your employees know about the existence of the marketplace. and how to get in touch. You need to be able to tell your employees whether the plan that you're offering meets the minimum actuarial value, that bronze level 60-40 plan, the minimum actuarial level value. You need to let your employees know that they may be eligible for tax credits and other types of cost-sharing reductions via the marketplace. And you also need to let employees know that if you're offering an insurance plan and if it's affordable and your employee decides to opt out of the plan and go into the marketplace themselves, that they are forfeiting your premium contribution. So again, you're not required as an employer to make the premium contribution for an employee who's decided not to participate in the programs, in the plans that you're offering. If they've gone outside and they want to do their own thing for whatever their reason may be, they need to know that that $242 a month that you were going to contribute, they're not going to get. So just make sure that this is clear to all of your employees and you'll be good to go. So let's talk about the big financial carrot for employers, which is in the form of a tax credit. New York State did a survey and estimates that approximately 80% of the small businesses in the state are eligible for tax credits. Only a sliver of them have claimed them. There are about $2 billion worth of tax credits available to the small business community. And trust me when I say not a lot's been claimed. So there's a lot of money, your money, sitting out there waiting for you to come and get it. And we're going to talk a little bit about how we're going to go about doing that. But first, I just want to make sure everybody really understands the difference between a deduction and a tax credit. So I created this little completely made up example. So, and I'm going to rock and roll through it. A deduction lowers your taxable income, but a tax credit actually lowers the tax that you owe on a dollar-for-dollar basis. So let's make believe here we have Company A and Company B. Company A has a deduction of $2,000. Company B has a tax credit of $2,000. Both companies have a base taxable income of $10,000. Again, this is all made up. So for Company A, as you can see, they've got a $2,000 deduction. So their, what I call adjusted taxable income is $8,000, the $10,000 minus the $2,000. And assuming that they have a 30% tax rate, the tax that they owe, since they have no credit, is $2,400. Now, let's look at Company B, the company on the tax credit side. They've got the same base taxable income of $10,000. They've got no deduction. So they're going to be taxed on the same $10,000. At that same 30% rate, their tax that they owe is $3,000. Except they've got $2,000 in tax credits, which are applied to that $3,000, the tax that they owe. So $3,000 less $2,000 equals $1,000. So Company B is paying $1,000 in taxes. Company A is paying $2,400. So you can see why the tax credit is such a powerful financial incentive for the small business community, because it's actually reducing the taxes that you owe. So let's talk about who's eligible to get these. So there are 3 hurdles that you have to clear in order to qualify for tax credits as a small business. The first one is you've got to have less than 25 full-time equivalent employees. And what a full-time equivalent employee means for the tax credit calculation is an employee that works 40 hours a week, or what would be 2,080 hours a year. So for example, if I have 2 employees, each working 20 hours a week, that makes 1 full-time equivalent employee. If I have a 30 and a 10, I've got 1 full-time equivalent employee. If I've got a 15 and a 10, 3 bodies, 1 full-time equivalent employee. So you can see if you may have 30 employees, but that doesn't mean you're locked out of hurdle 1. It's all about the math. Also, owners and their families do not count in the employee full-time, count as employees for the calculation of tax credits. So again, if I had a company with 30 employees and 2 owners, right off the top, I'm at 28. Those 2 owners do not count. Okay, the second hurdle. The average annual wage has to be less than $50,000. Again, that may not sound like a lot of money for businesses here in New York, but owners and their families, their wages do not count in this calculation. And typically in a small business, it's not unusual for the owners and their families to be pulling down the bigger bucks. So once you take that money out of the equation, you may suddenly find yourself in good shape on hurdle 2, the money in terms of annual wages. The last hurdle is the fact that you as an employer need to be contributing at least 50% in terms of the premium cost on behalf of your employees. So if you're, again, the 3 hurdles, the number of full-time equivalent employees you have, the average annual wage, and the fact that you're contributing about 50% to in terms of your premium contribution for your employees. Not only are for-profit businesses eligible for tax credits, not-for-profits are eligible as well. So if you're running a not-for-profit, or perhaps you have a colleague that's in a not-for-profit, or you're on the board, just know that these credits are available to you as well. They will not be applied against tax owed because 501c corporations don't owe tax. They will be applied against payroll taxes to do the reduction there. So the best part about tax credits is that this part of the law went into effect in 2010. So if you're a business and you've been paying, and if you've been offering your employees health insurance, and you've been paying premiums in 2010, 2011, 2012, and this year, 2013, you may be eligible for tax credits. I think the single best day that I had at the chamber was the day that I got an email from a member who attended one of my presentations, learned about the tax credits. They're a retail business right in this area, 9 employees. They were offering insurance to their employees. They didn't know about the tax credits. They went back and filed for them and got thousands of dollars. So this is the $2 billion sitting out there in the big pool that there are a lot of small businesses that just don't know that they might really qualify for that money for the past. Just know the tax credits for the years 2010 to 2013 max out at 35%. That doesn't mean everybody gets 35. It's a sliding scale. Your company may qualify for 22 or 16 or 10 or 31, but the cap is 35. In 2014, that cap is increasing to 50%. That's 50. So, but that's only for companies that buy their insurance via the marketplace. So that's the big incentive for you to say, gee, I'm eligible for these tax credits, or maybe I'm thinking about business growth, and maybe I can leverage the law and think about how these tax credits could help me attract a key kind of employee or retain a key employee, and gee, this is a great idea. Gotta shop in the marketplace in order to accrue tax credits effective in 2014. The other great thing about tax credits is that you can apply them going backward or you can carry them forward. And what that means is, let's make believe that you were offering insurance in 2011 and that you did qualify for tax credits, but you didn't owe any taxes. So suddenly you have all this money, but what are you going to do with it? The point is, let's make believe you hit the bonanza in 2014, you land a ton of great new clients, and suddenly you got to pay taxes. Well, you can take those credits, that dollar value from 2011, and offset the tax you owe in 2014, or maybe it's 2016, or maybe it's 2018, or whenever that is, or vice versa. If you qualified for a tax credit in 2013 and you owed taxes in 2011, you can do an amended return and use those credits going backwards. So tax credits can go backward and forward, which is another reason why companies really, really love them. Okay. The IRS form to claim tax credits is form number 8941. So, if you think you may be eligible, if you're talking to your accountant or your business advisors and there's no more important year than this one for you to get up close and personal with your accountants, your attorneys, your advisory board, your insurance brokers, to talk about how you can leverage the law and use these tax credits to your advantage. But if you're talking to your accountant, you kind of get that glazed look, tax credits, what are they talking about? Just say Form 8941 because accountants think in form numbers, you know. So, but that's the form. You can go right up onto the IRS website to pull it down and apply for credits if you think you're eligible. By the way, there are a lot of tax credit calculators online. You know, you don't have to do the math yourself. But I just wanted you to have a good understanding of the components and the eligibility requirements for to be able to accrue these credits. As I mentioned, as we've all mentioned, there are tons and tons and tons of resources online. The marketplace website, of course, being your single most important resource, since you can find just a wealth of information up there. And what's really great is it's organized by individuals, by families, by brokers, by this, so that you're not kind of like in cyberspace trying to find what you need. So hopefully this has given everyone the incentive to say, I'm calling my accountant tomorrow to find out whether or not that's my money sitting out there that I want in my pocket. And thank you very, very much.